So access to quality healthcare is an essential component of our well-being, and for many of us, specialty expertise, advanced technology, and state-of-the-art facilities are just a short car ride away, but it's not that simple for those living in rural areas. Dr. Rachel Hailey of HCA Midwest Health is here to talk about telehealth resources and outreach clinics. So Dr. Hailey, first off, how is technology actually impacting families maybe who would need that outreach service?
Well, it's really an exciting time in healthcare right now for many reasons, but telehealth is one of those reasons. Through the power of telemedicine, we can give access to healthcare regardless of where a patient or a physician is located. And telehealth allows us to connect world-class specialists and experts to the communities where they're needed the most. And, you know, patients are able to stay where they're close to home with their support networks of their family and their friends, and that's so important when someone is sick.
Well, and it's like we have FaceTime, we have video, we have camera, all at the reach of a fingertip, so why wouldn't we use it for our own healthcare?
Oh, absolutely. And it's amazing where we are using it. You know, doctors in emergency rooms and primary care providers in rural facilities across Kansas and Missouri can consult with medical specialists to give their patients the care that they need. So strokes are treated faster. Seriously ill expectant moms and their babies can have a lifeline to a neonatologist. And cancer patients can see their oncologist from the comfort of their own community and get the care they need, and so much more. In fact, HCA currently provides telehealth resources in psychiatry, pre and post surgery, neurology and stroke patients, inpatient cardiology, and more services to come.
Okay, and so everything that you just listed off were a lot of serious things, right? For people maybe if they had a baby a little bit too soon, they need that care and looking after. Are there any other examples that you can think of people who would benefit from this if they needed that outreach?
Oh, absolutely. You know, we provide innovative programs to to communities, like 20 communities outside the Kansas City area. And, you know, we can see them in the outpatient setting, in the hospital, and in the emergency department. So stroke patients can get the care that they need from an HCA Midwest neurologist, and emergency rooms can use their information and to help a patient get the care they need more promptly. And again, you know, pregnant mothers can have their babies treated and transported to a higher level acuity if they need it.
Well, that's so important. Now, let's talk about this, right? How does telehealth work? Because we've been talking about it a lot, but, you know, some people need that walkthrough process.
Yes, well, through advanced telecommunication techniques and technology, a physician can access the telehealth system through their computer, and then this physician appears on screen of this robot that's located in the patient's room. Very cool. And through this robot, they can move, see, hear, and talk to the patient like they're actually in the room. And some of these robots are even equipped with a stethoscope so they can listen to the patient's heart and lungs.
That's amazing, because it's sort of like you've got that access to a doctor from your own room.
Absolutely. It's amazing the technology that we have and what we can do with it.
Okay, so patients in rural areas needing specialized care can access telehealth in different ways. You know, what are some of those ways?
Absolutely. So it can occur in 3 different ways. Like I said, in the outpatient and specialty clinics, a cancer patient can talk to their oncologist without leaving their community. And using this approach, the patient doesn't have to travel to Kansas City unless it's absolutely necessary, like for a procedure or for surgery. And in the emergency department, like with a stroke patient, when, you know, seconds are critical, you know, the neurologist can guide the physician, you know, to what they need to do for that patient, and that can save lives and improve outcomes for those patients. And again, in the hospital setting with like a pregnant mom, you know, ideally a delivery for a high-risk mom can be planned in a hospital that has a NICU and a neonatologist on staff. But, you know, sometimes unexpectedly, you know, high-risk births happen. And yes, in hospitals where they don't have a NICU and a neonatologist. But through the telehealth system, you know, a neonatologist can be bedside with that mom and that baby, and you know, can lead the doctors and the nurses through what needs to be done for that baby. And if the baby needs to be transferred, even our NICU and maternal transports are equipped with telehealth, so that doctor can be with them through the entire way.
Well, Dr. Rachel Hailey, thank you so much for telling us all about telehealth, and to find out more information, you can visit hcamidwest.com.